So let us begin with one more important topic, and that topic is related with the Appendix L. And here we are going to talk about the non-surgical procedure in which the tubular medical device is inserted into the blood vessel in the leg or in the arm and moved to the coronary arteries, and it is called as a percutaneous intervention. It allows a physician to diagnose and treat the disease of the heart muscles, wall, and the coronary arteries. And it is used to give the intravenous fluid, blood transfusion, chemotherapy, and other drugs. When you are studying this particular topic, you must know the aorta and the parts of the aorta. So if you see this particular, the big vessel is called as aorta. It begins with the left ventricle and it ascends up, and then this particular arch like thing is called as aortic aorta. These are the ascending aortas, and then the aorta starts descending down, and that particular part is called as a descending thoracic aorta. And then we have a diaphragm, and the aorta continues down with the various abdominal aorta. This is part is called as abdominal, and then we have a infrarenal aorta. So these are the various parts of the aorta one must know when you are doing this topic. So now let us understand the important terminology related to this cardiac catheterization. The first is non-selective cardiac catheterization. What is this? It is a procedure that involves inserting a catheter into the femoral artery and threading the catheter up into the aortic arch. The catheter is placed into the main vessel such as aorta or the vena cava, and no further manipulation is performed. This could involve simply inserting the catheter into the vessel and then removing it or advancing it into the vessel like aorta. So whenever we are talking about a non-selective catheter, the catheter remains inside the aorta only. It doesn't take this route or this branches. So it remains in the main aorta, and that is called as a non-selective catheter. Means I have not selected any particular branch and the catheter remains inside the aorta. Now the next is a selective catheterization. Selective catheterization procedure, the catheter is inserted into the femoral artery and advances to the aorta. But then it continues to the other vessel beyond the aorta at the physician's discretion. The catheter is advanced from the initial access point into the branch vessel, requiring a manipulation and negotiation of the catheter. This can involve catheterization vessel beyond the aorta or vena cava, including first, second, and third order branch. So, in the selective catheterization, my catheter from the femoral artery, it comes into the aorta, but it doesn't remain in the aorta. It has taken this particular branch and then it has gone till here, and that is called as a selective catheterization, where the catheter has not remained in the aorta, but it has taken this particular branch. Now, the next important concept is the vascular order, and you must all pay attention. In the arterial system, the procedure, the level of the vessel is described as a vascular order. The initial vessel of the aorta or the access vessel is considered the first order. When this initial vessel start to branch, the resulting branches become a second order selection, and so on. The highest level of the selection in the arterial system is the third order. So let us take this diagram and I will try and explain. So this is the aorta, and we are talking about this particular first innominate. So this is the first order, then it bifurcates and forms the two vessels. So that becomes the second order, and this second order further bifurcate to give some branches. This is called as a third order. And I have used here the color coding that will help you to understand the first order, second order, and the third order. Now the second vessel, that is left common carotid also, this is the first order, then it is bifurcated, becomes a second order, and this second becomes bifurcated, it becomes a third order. And this is very important for you to do the correct coding. So let us understand the concept of the selective catheterization. Whenever you are doing the selective catheterization, the important guideline is we code for the highest level, that is access within that vascular family. So we will take one example. From the right femoral, artery is punctured and the catheter was placed in the aorta, that is 36200, and then the catheter was manipulated into the left common iliac, which is the first order, then into the external iliac and the common femoral, which is the second order, and then the superficial femoral artery, which is the third order. So when the catheter has reached this point, that is the third order, we will code only for the third order. So let us take the example. So that means, suppose from the aorta, if I cross the first order, third order, second order, and then the third order, I will code only for this. Because to reach here, I will already travel from here, here, and here. So you will always write the highest order. Now let us see how the Appendix L will help us. The Appendix L has all the vessels written, and they have written the first order, second order, and third order. So the first order was a common iliac, and then the common iliac has these three branches. We have entered into the external iliac, and from the external iliac we have reached to the superficial. So we will only code for this. We won't code this and this, because to reach here, the catheter has already traveled from here to here, and I have already shown here. Example. Okay, to reach the third order, the catheter has to travel first and second order. Now this is the appendix L, and one must understand appendix L. These are the arterial vascular family, and where they have given the main aorta and then the branches. This is the first order, second order, third order, and beyond the third order. And this is the venous vascular families, and where you can see that they have used the blue color coding, and there also they have clearly explained. And this is a very good illustration for all the vessels in your in the body, and that also gives you pretty much good idea about the first, second, and the third order. Now we have the two types of code, the catheter placement code. For the arteries above the diaphragm, we use this series, that is 36215 for the first order, 216 for the second order, third order is 217, and 36218 is for the each additional second order or higher selective catheterization. While whenever the vessels are below the diaphragm, the code range is from 36245 to 36248. Because if this concept is clear, then it is easy for you to eliminate the wrong option. First of all, you need to find out whether that vessel is above the diaphragm or below the diaphragm, and that pretty much take away lot of options, wrong options, and easy for you to answer. Now let us understand the guideline. So the first is identify whether you have done the selective or non-selective catheterization. Now you pretty much know what is selective and what is non-selective. Then when selective, identify the blood vessel catheterized, because selective means you are entering a particular branch. So you must know everything about that branch. Second is identify the order with the help of appendix L. When two or more than two vessels involved in the catheterization, for the blood vessels of the same family with a different order, code the highest. And for the blood vessel of the different family with the same or different order, code separately. So I'm going to explain to this. Now, whenever you talk about the same family, this is one family, remember, and this is another family, and this is another family. So whenever I am talking about one family, I will, and if my catheter has come here, I will code the highest. But if I am talking about the two different family, like this family and this family, then I'll have to code both. Okay, I'll have to code both, and I will put the modifier 59. Now pay attention here, very very important. uh, let's say for example, in the first family I have gone till the third order, okay, and then I retract the catheter, I go into the second family, but I go till the first order. Then how will I code it? So I will code the third order for this family, and I will code the first order for this family. Why? Because the family is different. This is very, very important. Here, because we are talking about two different families. If it is a one family, I will code the highest. If the catheter has gone till that point, I will code the highest. But when it is a two family, this is how I will code. And I'll put the modifier 59. Step 4 is select the code based on the location of the blood vessel. For the upper extremities or the vessels above the diaphragm, we code it 36215 to 218, and below the diaphragm, that is abdominal, pelvic and lower extremities vessel, we code 36245 to 248. And for the renal, we have the code separate code, that is 36251 and 36254. Very important. So let us take one example. In the cath lab, from the right femoral artery access, the following procedures are performed. Catheter placed in the left renal, accessory renal and superior to the left renal and one main right renal artery. Radiological supervision and imaging is performed in all locations. What CPT codes are reported? Now here you have the code. Remember, for the renal artery we have a separate code, and those codes are not 36245. So we will eliminate the wrong option. So the 36245 is for the vessel below the diaphragm, and though renal is below the diaphragm, we have a separate code for the renal. So we are going to eliminate B and C because they are not talking about the renal. Now we have the code A and D. Now what happened here is catheter placed in the left renal, accessory renal superior to the left renal and one main right renal. So basically both left and right renal were approached for this procedure. So let us look at the code. So if you see the code 36251 and 252, and this is the code for the selective catheterization 36245 we have already eliminated. So we will see this code and we will zero down our answer. So our answer will be 36252 because 36251 it is a selective catheterization placement first order main renal artery and any accessory renal arteries for the renal angiography, and it includes the image guidance because here everything is written fluoroscopy contained injection image processing permanent recording of the image and then the radiological supervision and interpretation. So this is a one code which includes everything, but it talks about unilateral and we have done both left and right. So we will have to pick up the code 36252 which is an indented code. So I'll read the above code language till the semicolon that is still here and I will use the word bilateral. So my answer will be answer D 36252. The femoral artery is punctured with a needle and the catheter is threaded over a guided wire which is fed through the artery into the aorta and selectively placed into the right and the left common carotid. An angiogram was performed bilaterally showing the minimal tumor blush but no other pathology identified. What CPT code describes the service? And we have the options. Now remember, first is we have to find out whether it is a selective or non-selective. So in our case, it is a selective because it is very clearly given selectively placed into the right and the left common. Then second question is identify the blood vessel. What are they? It is a right common carotid and left common carotid. Now identify the order with the help of Appendix L because you must know how to read the appendix. So the right common carotid is the second order and left common carotid is the first order. You can see the Appendix L. I will show you the Appendix L. So here in this you can very well see that what is the first order and what is the second order. And then you have to identify the location of the blood vessel. Are they upper extremities or lower extremities? So definitely this is a upper extremity vessel. So let's go ahead. So the our vessels are right common carotid and the left common carotid. Now I have given you this particular diagram which is there in the Google. You can always search. It's an excellent diagram. So the right common carotid, it is the the second order. Okay, second order branch, and then the left common carotid is the first order branch. But if you see, the families are different. Right common carotid is this family, and I have used the different color coding for the family, and the left common carotid is the first order, but the families are two different. Okay, this is a blue family and then the green family. So the data which we have collected is a selective catheterization. One family is the second order, and in the second family we have gone till the first order, and these are the vessel above the diaphragm. So we will use the 215 series. Now in this case, how will you code it? So you will code this family, the second order, by 36216. Okay, and then this another family we have gone till the first order. I am going to code 36215. Okay, and this is for the imaging, and so my final answer will be 36216 RT for the right, and 36215 59, that is the left common carotid, and then you will write the imaging. And modifier 59 is required to show two separate families coming off the aorta. Take one more example. The catheter is placed in the left common femoral artery in the retrograde fashion, which was directed into the right iliac system, advancing it into the external iliac. Dye was injected and select right lower extremity angiogram was performed, which revealed the patency of the common femoral and profound femorals. The catheter was then manipulated into the femoral artery, in which a select lower extremity angiogram was performed, which reveals the occlusion from the popliteal to peroneal artery. What are the procedure code to describe? Let us have our data. So this is the selective catheterization, and it is definitely for the vessels which are below the diaphragm. Now, how do I come to know? You can directly go to the diagram and check whether the vessels are above or vessels are below. But when we see the vessel name iliac, it is definitely below the diaphragm. So we have our code. So in this code, if you see the 36217, this is a series above the diaphragm. So I'm going to eliminate A and C option. Now you have the option B and D. So in between, the code, the first code is same. What is going to decide is the second code. And so for that, we need to check what is 75716 and 75710. So what they have done is a angiogram that has been done for this patient. So from the given data, we have seen that they have done the catheterization of only right side. And that's why, because 75716 and 10, it differs only whether you have done the angiography of one extremity or the two. And in our case, we have done it only on the right side. So D is the correct answer. So 60-year-old male with a history of tachycardia present to the ED with epigastric pain and hematemesis. The patient is escorted to the endoscopy suite for the selective catheter placement to localize the bleeding. Under the ultrasound guidance via right femoral approach, the catheter is advanced into the aorta, then the celiac, and then the common hepatic arteries. Via the same catheter, a microcatheter is introduced into the gastroduodenal artery. So till here they have gone. Angiography is performed within the vessel. What are the procedure code? So this is the abdominal aorta. This is the first order. This is the second order, and this is the third order. You can see here it is a celiac. Then here we can see the common hepatic, and the common hepatic has the branch gastroduodenal and proper hepatic. So we got our answer that the catheter has started from the abdominal aorta and it reached to the third order. And within the same family, when it reaches the highest order, we just code for that. So that is enough for us, and 36246 is about the second order. So we will eliminate option A and C, and in between B and D, we will zero down our answer. So from the previous slide, we know that our catheter has gone till the third order. So 36247 is the appropriate code. And in between B and D, if you see the 70,000 code, one talks about the ultrasound guidance for the vascular access requiring ultrasound evaluation, while the 75726 talks about the angiography. And in our patient, we carried out the angiography, and that's why D is the correct answer. And this is my final slide. The only way to master this particular chapter is do lot of questions, read the parenthetical notes, try and understand what is the first order, second order and third order, and try and understand whether you are coding for the one family or two different families.